think the key lessons we learned, which I would like to share, is that trust was more useful where it existed before it was needed. There were studies done by Africa CDC, surveys on, for example, acceptance response, wearing of masks, social distancing. And what was seen is that the rate of acceptance of these public health measures were higher where people originally trusted their governments, even before the pandemic. Ethiopia, for example, had high levels of trust. And therefore, the government announcements and policy positions were more accepted and not questioned by the population. We saw the same with Rwanda because they trusted their governments highly. In areas where there were political division, there was a strong opposition that was fighting with governments. We saw less and less trust for governments, and we saw more and more attacks on the government policies and responses. But as I conclude, it's to say that there are things that work. Where we found things working was, number one, as I said, where trust existed before. But number two is where the responses were people-centered,